Okay, so here we will discuss about QT interval. So normally the QT interval is less than 440 millisecond, correct? Now there are different conditions when there is increase in QT, like in here the QT interval is more than 480, so definitely it is more, right? So the condition is your LQT1. So we will see different conditions where the QT is more than 440. One of them is a is a congenital disorder, right, which often remains underdiagnosed and often predisposed to your ventricular tachyarrhythmia. So this is a LQT1 or long QT. LQT1 is known as long QT syndrome. So it is an underdiagnosed congenital disorder and one of the cause of long QT and predisposed to your ventricular tachyarrhythmia. So this is, you must understand, and also there are other conditions we will see where the QT interval is prolonged, right? One is a congenital long QT syndrome. So now it is an inherited disorder of myocardial repolarization actually, okay, typically due to ion channel defects, and the increased risk of sudden cardiac death due to torsades de pointes. We will see torsades de pointes in our coming slides. So here just remember it's an ion channel defect. Okay. And there are two syndromes as well you can remember. One is Romano-Ward syndrome, which is autosomal dominant pure cardiac phenotype, and another is Jarvel and Nelson syndrome, which is an autosomal recessive and there is sensorial deafness associated, right? Now talking about drug induced long QT, very important, okay, drug induced long QT. So long QT interval and the drugs responsible. One is your antiarrhythmic drugs classification. If you go class 1A and 3, so antiarrhythmic drugs class 1A and 3. Then some antibiotics like macrolides, they can increase your QT. Then some antipsychotics like haloperidol, okay, they can increase your QT. Then antidepressants like TCS, tricyclic antidepressants. Then there is antiemetics like ondansetron. So all these drugs can increase your QT. Antiarrhythmics 1 and 3, antibiotics like macrolides, antipsychotics like haloperidol, antidepressants like TCS, antiemetics like ondansetron. So all these drugs, you must remember, they can prolong your QT. And also remember the ion channel defect, congenital long QT, okay.